So when you meet your GP, get the blood test done and look for diabetes, high blood pressure, cholesterol, these things early, and get a memory test done early, right? So you know that not only the diabetes you are screening for, you are also looking for other elderly related problems like dementia. Meet your doctor and discuss about all the early symptoms, and then before they become a significant problem later in life, recognizing early and treating them is a key thing. And then practicing the lifestyle. When you stop doing it, then you will start losing it.
The Docs Podcast, and today with Dr. Sithira Seneviratna. Dr. Sithira මම ගෙන්න ගත්ත වෙන මුකුත් මන්ද නෙමෙයි. He is someone who does a job that I have a lot of respect for. Dr. Sithira කියන්නේ වෘද්ධ රෝග විශේෂඥයෙක්. ඒ කවුද? ඒ නම අහලවත් නැහැ නේද? ඒ නම අහලා නැති වෙන හේතුවක් තියෙනවා. අපි ඒ ගැන Dr. Sithiraගෙන් අහමු. මොකද්ද මේ? එයා මොනවද කරන්නේ? එයා කවුද කියලා. Firstly, Dr. Sithira, thank you so much for coming.
Thank you for inviting.
So, වෘද්ධ රෝග විශේෂඥයෙක් කියලා කිව්වට I'll explain this in English. That is a geriatric medicine specialist. නැත්නම් වයසට ගිය අයගේ වයෝවෘද්ධ අයගේ රෝගවලට විශේෂඥයෙක්. Geriatric specialists are rare in Sri Lanka, Sithira. I believe you are the first one I have met.
Yes, I'm the first board certified.
First board certified consultant geriatrician. Well, congrats first of all. It's an honor to have you here. So, Dr. Sithira අපිට කතා කරන ගොඩක් දේවල් තියෙනවා. And අද මේ podcast එක වැදගත් වෙන්නේ අවුරුදු 60 පැන්න අංකල්ලට ආන්ටට විතරක් නෙමෙයි. එහෙම හිතන්න එපා. අපි හැමෝටම අම්මලා තාත්තලා ඉන්නවා. අපි හැමෝටම වයසක ඥාතියෝ ඉන්නවා, යාළුවෝ ඉන්නවා. It's important for everyone. So please do listen. And if you have questions for Dr. Sithira, leave them in the comments below at the end, and I will have him back again because it's a vast topic. And අපි දෙක දවසෙන් ඔය ඔක්කොම discuss කරන්නත් බෑ. And I do believe Sri Lanka's population is aging, isn't it, Sithira?
Yes.
And these problems are getting more and more common.
Yeah.
So let's start. I'd love to know, what made you pick geriatric medicine as your specialty?
Actually, I like to work with older people. Yeah, that's the main thing. And the other thing is this is a kind of a need of the hour at the moment for Sri Lanka also. So as you said, Sri Lanka has a fast aging population. දැන් පහුගිය දවස්වල සංගණනයක් තිබුණානේ. ඔව්. ඒ සංගණනයේ හැටියට අවුරුදු 60ට වඩා වැඩි අය දැන් 18%ක් ඉන්නවා. 18%. It's a sharp rise from what we were having in early 2000s. Even in 2012 it was not this range,
right?
And it's predicted to go more than that as well,
right?
Yeah, it's predicted in 2040 1/4 of our population, 25% will be more than 6 years.
I mean, if you think about it, this is an indication of how good our healthcare is, right? I mean, people are not dying like they used to, and they're living healthier, they're living longer. එතකොට our top population demographics becomes top heavy.
Yes, there are several factors. As you said, one factor is people are living longer. So when you compare with 1940s, people lived less than 50 years in Sri Lanka. Average life expectancy at birth was less than 50 years. And now females live up to 81 years and males more than 75 years. So our life expectancy is getting higher each year. So as you said, the improvement in healthcare also contributing. The other thing is birth rate is getting lower and lower.
That's a good point.
Yeah, birth rate is getting lower and lower. And on top of that, young generation migrates. And I also saw some new thing actually recently. There are significant amount of people coming for retirement also after 60s.
Yes. Lanka is supposed to be a retirement haven, so
so altogether population more than 60 is rapidly increasing.
Right.
So their health problems are very difficult to manage. It's not like managing diabetes, high blood pressure in younger people. It's slightly different. So because of all these factors, and because I like to be with older people and talking to them, and it's kind of very interesting area to do also as a physician, and we have to deal with a lot of complex problems, and because of all of those reasons I decided to do geriatrics.
So this is why I said he's someone very close to my heart, because I share your passion in this, and I'm a GP who now does more or less exclusively house calls for the elderly, and this started after COVID, looking after most of මගේ රට ගිය යාළුවෝ, ඉස්කෝලේ යාළුවෝ, කැම්පස් එකේ යාළුවෝ රට ගියාම අනේ සුනෙත් බලා ගන්න කියලා අම්මලා බාර දීලා තාත්තලා බාර දීලා ගියේ මට. So it started like that, but now it has become my primary private practice. I think I understand where you're coming from, and I'm very glad you're here today, because මට අහන්න ඕන වැදගත් ප්‍රශ්නයක් තියෙනවා. ඒක මගේ අපේ ප්‍රේක්ෂකයන්ට පැහැදිලි කරන්න. ඇයි මේ දැන් දැන් ඕක GP විතරක් කරන්න බැරියයි. දැන් මම දන්නවා ඕකට පස්සෙ උත්තරේ මම හොඳට දන්නවා. ඒ වුණාට මට පැහැදිලි කරවන්න ඕනේ from a specialist. මොකද්ද මේ වැදගත්කම? ඔකනේ වෘද්ධ රෝග වයෝවෘද්ධ වයස්ක අයගේ රෝගවලට වෙනම ස්පෙෂලිස්ට් කෙනෙක් ඉන්න ඕනගේ වැදගත්කම මොකක්ද?
So actually it's a very good question. So we all are familiar about pediatrics, right? So young children, they need a separate specialist. It's kind of a separate specialty. But when it comes to geriatrics, people are still not familiar about the word geriatrics, and that older people also need specialist physician's care. That's mainly because when an older person presents with some kind of a medical problem, so it's not simply only the presenting medical problem we have to deal with. We have to deal with a lot of other problems which are sometimes associated with aging process. And with aging, these people, older people, they develop there's a certain group of diseases called geriatric syndromes, right? On top of that, they are developing a medical complication as well. And then we have to think about their disabilities, how their body is different from because of the aging, and also geriatric syndromes, medical problems, their drugs, their psychological and social problems all together, and provide a practical solution. Otherwise, some of the solutions might not be suitable for each and every person. එක්කෙනෙක්ට දෙන වේද අනිත් එකකට දෙන්න බෑ. ඒක always you have to do some kind of a very personalized type of a tailor-made kind of a management plan for all the person. Otherwise, they will end up with a lot of problems. Yeah, I'll explain few things about the geriatric syndromes just to be aware about these things. In geriatrics, we have 7 syndromes which we call geriatric giants. We call them geriatric giants. ඒවා තමයි මේ අර older කෙනෙක්ගේ තියෙන ගොඩාක් මේන්ම ලෙඩ වර්ග කියලා අපි අඳුරගෙන තියෙනවා මේ other than the other medical problems like diabetes, high blood pressure. First thing, immobility. Immobility is difficulty in mobilizing. If you think about an older person, they spend most of the time in bed, right? And some people, bed and chair. Some people are homebound. They don't go outside the house. So as a result of immobility, people develop various kind of problems. And when you give medications also, we have to take into account that he is immobile patient who we are treating. So we have to take that into also account. The other one is instability. Instability means falls. So all the people are falling over. Kind of a huge problem for all the people. So if you look at the stats actually, now they say if you are more than 65 years, within 1 year, 1/3 of the population more than 65 years will have a fall. If you are more than 80 years, half of the population will have a fall within 1 year. And person who has a fall has twice the chance of falling again.
Falling again. Yes, correct.
It increases double risk එක. risk එක double වෙන වැටෙන්න තියෙන chance එක. දැන් ඒක නිසා මේ දෙවෙනි problem එක විදිහට මේ falls කියන එක අපි identify කරගන්නවා. එතකොට මේ දැන් අපි දෙන medications වලින් falls වෙන්න පුළුවන්. නැත්නම් ආයෙන medical problem එකකින් falls වෙන්න පුළුවන්. ඒ නිසා falls කියන එකත් අපි අපේ equation එකට ගන්න ඕන patient treat කරනකොට. තුන්වෙනි එක තමයි we call it impaired cognition. That means basically memory impairment. A lot of people have memory problems. We call it dementia also. It could be dementia. It could be something called delirium. A lot of problems that can affect someone's memory. It also definitely directly involved with your management plan. If somebody is unable to remember, taking medication sometimes you have to simplify the medication. And there are some medication which can cause people, give them delirium, give them confusion, especially if they are vulnerable. You have to consider their cognitive state before treating them. Impaired cognition is the third thing.
Correct.
Yeah. The fourth one is another one which is we usually neglect called incontinence. Correct. Yeah. So this kind of a hidden problem also sometimes. People don't come out with these problems sometimes. Mainly urinary incontinence. Sometimes they also develop fecal incontinence. And urinary incontinence also in old age is considered as a geriatric syndrome, and it's a result of failure of many mechanisms. It's not just due to a simple hernia. It's not just due to a simple some neurological problem. It's a combination of things. Cognition, immobility, drugs, aging related problems, pelvic floor weakness. It's a collection of things that ultimately result in urinary incontinence. So it's another syndrome. The other one is iatrogenic hospital. That means polypharmacy. Correct? Polypharmacy. You also call it polypharmacy. That means drug-induced problems. So I usually say half of the problems in older people are sometimes drug-induced. So people come with certain complaints like dry mouth, loss of appetite, constipation, confusion. most of these problems are drug induced sometimes, right? So as a rule of thumb, we say if an older person taking 5 or more medications, we name it polypharmacy and we list this as a problem, right? If someone is taking 10 or more medications, we call it excessive polypharmacy, right? Then, chances of these drugs interacting with each other is very high.
Correct.
And when we give a medication, we have to go through all the medications. Otherwise, patient will end up with a side effect, right? And as geriatricians, usually when they prescribe a medication, we try to de-prescribe a medication.
Correct.
we don't want long drug lists, right? And sometimes when a patient presents to us, we are not giving a medication, we are cutting down the medication. This process is called de-prescription. So when you are younger, when you develop certain diseases, we prescribe. We keep on prescribing. Then the drug list goes up. When you are older, we cut down them. We call it de-prescription. All right? So this is the fifth problem. Then the other problem is isolation and depression. So social isolation has become a huge problem. And as a result of that, people are developing depression and other psychological problems and lack of social support. We have to consider this also into account when we, treat these patients. And the other one is called impaired homeostasis. All right, in simple words, in medical words, we call it frailty. It's also a very, less known disease actually. So when you get old and older, your body functions, your physiology become very much restricted that you can't withstand external stressors. As a result of it, you're vulnerable to smaller increase in medications. For example, when we increase high blood pressure medications, they will develop suddenly low blood pressure and have a fall. When we give hypoglycemic medication, they develop low blood sugar. When we develop certain medication, they develop low sodium. They develop incontinence, right? So they are very much vulnerable to medication as a result of frailty. And also, when they get a minor illness, their functional levels will go down. පොඩි ලෙඩක් හැදුනම ඒගොල්ලෝ ඇඳට වෙනවා ටක් ගාලා. ඊළඟට හොස්පිටල් එකේ ලෙඩ මේ හොඳ කරලා ගෙදර එවුවට නෝමල් වෙන්නේ නැහැ. බෑක් ටු නෝමල් වෙන්නේ නැහැ. ඇඳේ ඉන්නවා ගොඩක් වෙලා. ඊට පස්සේ මේ අර හිටියට වඩා ෆන්ක්ෂන් එක ගොඩක් අඩු වෙනවා. ඊට පස්සේ ඊළඟ සැරේ ලෙඩ හැදුනම ඊටත් වඩා අඩු වෙනවා. ඉතින් gradually over the years what will happen is their function level will go down. But usually what we do is, in our day-to-day practice, we treat them reactively, we treat the acute problem. But over time, their functional level will only go down. Because we don't do anything to reverse frailty.
Correct.
Right?
Correct.
So this is the seventh problem. So we have those 7 things as, geriatric syndromes. And the important thing is one person has not only one, they have several geriatric syndromes. Now think about a older person, 80-year-old older person with cognitive impairment, urinary incontinence, frailty, and social isolation presenting with high blood sugar. So you're going to manage it not like a 50-year-old patient who is working CEO presenting with impaired blood sugar control. Completely different. You have to consider several things. That's why geriatric medicine is different from the usual medical care. So you have to, tailor-made them, treatment plan according to the patient, considering all the geriatric syndromes as well as the aging-related other issues.
It's interesting few points you brought up. The සිතර මම ඔක කියද්දි මම අහනකොට මම කල්පනා කරේ අපේ දැන් ජෙනරල් ප්‍රැක්ටිස් එකේ තියෙන මේ value එකක් නේ that we treat the individual, not the disease. ඉතින් මම දකින දෙයක් තමයි උතන when you are involved in treating the individuals from the individuals, and also they need to understand why it's important. ඒ කියන්නේ දැන් why a geriatric medicine specialty is important. ගොඩක් වෙලාවට අපේ දැන් ලංකාවේ health එකකින් behavior එකේ පොඩි ප්‍රශ්නයක් තියෙනවානේ. I mean it's the elephant in the room, but there isn't someone who guides them through their journey in health. Sometimes they find their own specialist and go. But I love the fact what you mentioned. ඔතන කියපු වැදගත්ම දෙයක් තමයි frailty. මොකද හැමෝම දැන් falls ගැන කතා කරා අපි. fall එකක් වුණාම දැන් මගේ clients ලා ගොඩක් වෙලාවට හිතන patients ලා හරි ඉතින් ආයේ hip එක ගන්නත් අපි hip එකක් දාමු. එතනින් ඉවර වෙන්නේ නැහැ සිතර කතාව. hip එකක් දැම්ම කියන්නේ surgery එක පැය 6 2 3 කරලා ඉවර කරලා ඊට පස්සේ recovery එක. කොච්චර debilitation එකක් වෙනවද, කොච්චර rehabilitation කරන්න ඕනද. ඒ කියන්නේ you're looking at good 6 to 8 months of rehabilitation and you may never walk normally again. Sometimes you may not get out of bed again, but the surgery is done. So the surgeon's part is over.
That's a very important topic. Statistics are far more, scary. In developed world, after hip fracture, 30% of people will die within 1 year. It can be, hip fracture can be a life-changing, thing for an older person. And in Sri Lankan studies, they have shown, even in some studies, even after 1 year, nobody was back to normal mobility-wise. So, they will have some kind of dependence.
Exactly.
Right? Yeah, so recovery from hip fracture is very difficult. So, best thing is prevention. The false prevention.
Absolutely.
Yeah, false prevention is absolutely important.
Exactly. So that's one very important thing that you mentioned while saying that. The second thing I noticed when you were saying this is of these 7 key pillars of geriatric medicine, the level of consciousness or the clarity. Again, ඒකත් දැන් අපි මේක දැක්තරම් පොඩ්කාස්ට් එක පටන් ගන්න කලින් මාසිතරය කතා වුණා. අපි we age physically. Sometimes if you are, for those who don't have dementia, for those who don't have Alzheimer's, mental age doesn't really go down. අපි කියන්නේ 50 60ට වඩා අපි mentally age වෙන්නේ නැහැ. හැබැයි physically අපි 80ට 85ට ගිහිල්ලා. ඉතින් ඔය gap එකත් එක්ක සිතර what are the, I would love to hear from you, what are the challenges that you see with this physical and mental age gap?
It's a quite interesting question, actually. So it can cause a lot of frustration, actually. And sometimes you have to be aware about, your own body, how things are going, and be realistic about everything. But said that, different people, age differently. Some people age faster. Some people age very slow. Some people you might see even at 80 years, they are like 60. Some people at 60, they are like 80. Right? Okay. So mental, especially the physical aging, actual physical side of aging, so there are a lot that can be done to be in par with the mental aging, right? Okay. And we fit even at your 80. So we call this concept biological aging. So when I ask what your age is, you usually give from chronological age.
Yes.
Yeah. So so biological age is also very important. There are a lot of discussion about this actually around the world, whether we can slow down the age, whether we can reverse the age even, and the results are all positive actually. There are a lot of things that can be done to slow down aging, right? And there are important things. One important thing is good diet, right? So consuming fresh fruits and vegetables, and less artificial type of food. Right? That's one thing, right? The other thing is exercise. Physical exercise is very important, especially it might not be going to a gym and doing exercise. That's also very important to strengthen your muscles, but also for everyone, just keep moving, especially after your 60s, after retirement, you have to be mobile. So I see a lot of people after retirement, they sit and watch TV.
Yeah.
Right. Okay.
Exactly.
Yeah. And that leads to muscle loss, right? And then loss of balance and lots of other problems. So you need to keep moving, right? And then the other thing is very importantly, maintain your social connections, right? So being socially active has been shown to be very important, right? Even latter part of your life, right? To improve your mental as well as physical health. Right? Social connections is very important. The other important thing is having a purpose of life that we, rarely discuss.
Correct.
And when I asked from a lot of older people in, our situation, and most of them have lost the purpose of life actually. So after retirement, they don't have any kind of drive, anything to look for. Yeah, when we wake up in the morning. So that's very important thing to drive your day, and it has been shown a factor to slow down the aging as well. And also, as doctors, you would agree, screening for medical problems, screening for cancer, and finding these geriatric problems and then correcting them as we go on, do stuff to reverse frailty. That type of thing also will help.
Absolutely.
Yeah.
So 3 take-home points which I would like to emphasize once again. I'm glad you brought this up. 3 important things that Dr. Sithira said. One is to have a purpose in life. It's very important. As you get up every day, you have to have something. Until the day we die, we need to have some purpose. And 2 is to keep your mind active, to be socially active. I'm sure all our Opadupa aunties will be happy to hear this. If you're keeping your mind active and if you're keeping your social connections active, that's very important. Keep that in mind, especially if you have elder relations or friends who have elderly parents. Go and talk to them. Take some time. That little connection that you make, because you may not ever see them again. You never know when the last time you see somebody. For the elderly, those connections are very important. For someone who's crossed the age of 75, for them, those connections mean a lot. And then, like you said, it keeps their brain alive. It keeps their brain functioning. Those are very, very important things. And the third most important thing he said was exercise. regular exercise, walk around the house even. Just keep your muscles active, keep your brain active, and keep your purpose in life active.
If I add another one is diet.
And the diet. Yes, absolutely. Because the diet also changes with time and with සමාජයේ මේ වෙන පරිණාමයත් එක්ක අපේ diet එකත් පරිණාමය වෙනවා. ඒ වුණාට it's very important to have a healthy diet and that also අවශ්‍ය ප්‍රමාණයට diet එක. අපි අවුරුදු 30 40 කාපු කෑම අපිට 60 70 කන්න බෑනේ. The calorie intake as well as the nutritional value of the intake also, no? That's very important.
And special emphasis on protein when it comes to diet. Absolutely. All the people in our situation, actually, a lot of people eat less protein.
Correct.
Yeah. And even if you are vegetarian, you have to find vegetarian sources of high protein, right? For example, pulses, atavarga, kadala, cowpea, mung, even dal has good amount of protein, right? Talk to your doctor and, according to your dietary, pattern, find which diet has high protein and include high protein that will improve your muscle.
Correct, absolutely. Before I ask another question, one important thing that I want to emphasize on polypharmacy. You spoke about this. I want to bring this up because I see this a lot, and when I lecture the postgraduate GPs also, mama අනන්ත කියන දෙයක් තමයි බෙහෙත් 10 12 දෙන්න සම්බලට මම බලන ලෙඩු ගාවත් ඉන්නවා බෙහෙත් හරියම නෑ ඇත්තට pharmacy වගේ. There are like 15 drugs. These are 60 70 year old patients, every individual has prescribed their thing, and you put it all together. Nobody looked at the patient. Everyone looked at their disease, and you have people taking 15 medications, 10 medications, and I mean these medications in combination cause problems. At the very least they'll cause gastritis. At the very worst they'll act up with each other, combine with each other, and cause even more problems.
Yes.
So I love what you said about if you give one drug, take one drug away. මම හැමදෙස්සෙම බලන්නේ like when I prescribe, I always see long term benefit එකක් තියෙනවා. මේ මිනිස්සුන්ට long term එකක් නැහැ. අපි බලන්න එපා ලෙඩාට සෙතක් කරනකොට short term benefit තියෙනවා, long term benefit තියෙනවා. ඉතින් long term එකක් නැත්නම් long term benefit තියෙන drugs දෙන්නත් ඕනේ නැහැ.
Exactly, agree. Yeah.
Exactly. So when you're dealing with, this is a message to my doctors, to my GPs who are listening. I mean, when you're dealing with your patients, always think පුළුවන් තරම් අර elderly patients ලගේ drugs ප්‍රමාණය අඩු කරන්න බලන්න. And even for patients, තමන්ට දෙනවා නම් තමන් බෙහෙත් 10ක් 15ක් බොනවා කියලා. Visit your GP, visit your geriatric specialist and revisit your prescription. මොකද ඕක පුළුවන් තරම් අඩු කරගන්න එක අපේ අර quality of life එකට වාසි. Exactly. So Sithira, just to wrap things up, I'd like to ask you, since I'm fascinated actually to have a geriatrician with me because it's a field that I didn't know existed locally. Man danna oka lokale tiyenwa kiyala mara ættarama Lankaවේ හම්බෙච්ච first geriatrician. So are there any subspecialties in geriatric medicine? How does it spread beyond this?
Yeah, actually, yes. Very good question. So one of the biggest subspecialties in geriatrics is orthogeriatrics. That's also one of my favorite things actually to talk about. So especially these older people who develop falls and fractures. Right now, the world has moved, very far from how to manage these patients. Right, so geriatrics has a huge role to play. Especially if you have a fall and a fracture, how to look after them during the time of surgery. So we also call it perioperative medicine. So geriatricians are perioperative physicians for older people, right? And also, after the fracture, most of these patients, they do the surgery, they go home, they forget about osteoporosis. You get the fracture because your bones are brittle, right? So you need different people need different agents. So depending on your risk factors, geriatricians will give medication to strengthen the bone, right? And also, why did you get the fracture? Because of the fall. If you don't correct the fall,
you get
another fracture, right? And people having hip fractures, they become very confused, right? Then cognitive side of this patient also needs some form of rehabilitation and follow up. So all those factors will be taken care by the geriatrician. So we call it orthogeriatrics. And then some of the older people, they will have incurable diseases, especially advanced cancers and advanced diseases like even heart failure, kidney failure, liver failure. They become incurable at some point. Then you need a lot of palliative care skills for elderly, care physician. So there's a subspecialty called geriatric palliative care also.
Right, I see.
So now it has also grown into separate subspecialty. And now, there are some other specialties like oncogeriatrics, where geriatricians work together with oncologists to improve the quality of life of all the people who are having cancers, right? And then there are cardiogeriatrics also coming up. There are a lot also now, from the geriatric medicine, there are a lot of specialties also.
Specialties also.
Yeah, coming up around the world actually.
Right, brilliant. Yeah. That's good to know. I hope we'll see more of them locally also. So Dr. Sithira, then as a parting advice, can I ask you, for the benefit of our viewers, some simple things and steps, like especially most of us who have elderly parents at home, some preventive things that we can do to improve the quality of life of the elderly?
Yeah, very important question, and practically also it will be very important to the listeners. So one thing is, as I said, always you need to screen yourself for diseases that can be prevented, right? So when you meet your GP, get the blood test done and look for your diabetes, high blood pressure, cholesterol, these things early, and get a memory test done early, right? So that not only the diabetes you are screening for, you are also looking for other elderly related problems like dementia, all right? And also you can get a balance test done, all right? Then you know how your balance is. You can get your bone density screened, whether you have osteoporosis or not, all right? Okay, so meet your doctor and discuss about all the early symptoms, and then before they become a significant problem later in life, recognizing early and treating them is a key thing. And then practicing the lifestyle, all right? They say when you stop doing it, then you will start losing it.
Correct, absolutely.
All right?
Yeah.
Okay, so you need to keep doing it all the time, even after retirement. Mental work you have to do, social work you have to do, physical work you have to do, right? Keep on doing, right? Don't stop doing the things you used to do. Try to keep being active, right? Okay, that's very important. And then adherence to medications, as well as you said, if you have any kind of problems with managing medication, discuss with your doctor and try to cut down medications. So all those things are important when it comes to a healthy retirement life for older people.
Absolutely. So we discussed a lot of important things today, Dr. Sithira. We spoke about, who is a geriatric specialist, why it's important, and why it's important for us as a country. For the Lanka population, elderly population, very වෙන්න හේතුව මොනවද, and වැඩි වුණාම වෙන්න පුළුවන් ප්‍රශ්න මොනවද, geriatric medicine කියන්නේ මොනවද, and geriatric medicine වලින් අපිට ගන්න පුළුවන් අර ආවාද මොනවද කියලා and දේවල් අපි discuss කරා. If you have any questions for Dr. Sithira, please leave them in the comments. I will have him back because this is a vast topic, like he said. So much we can discuss, and we will discuss in future, and we'll be back soon to discuss some more topics. Leave them in the comments. But for the time being, Dr. Sithira, thank you so much for coming.
Thank you for inviting. Thanks.